So PACU is the post-anesthesia care unit. That's what it stands for. And then we kind of switch between pre-op and post-op. So we get patients ready for surgery, and then we also recover them after surgery. So like as soon as they wake up from anesthesia, where they're taking care of them, making sure they look okay, vitals are good, pain and nausea is controlled, before we either send them upstairs to stay the night or go home after surgery. Some days we have up to 60 cases. Some days it's in the 30s. So it kind of, I would say on average, maybe like 45 a day. Hand washing is a big one, and then the hand sanitizer as well before the patient arrives. And then if, we always use gloves as well for like going to be touching the patient or anything. And then in between steps as well, if we step away to go get medication or to go grab something for the patient, then we come back. Then we wash our hands again and then continue on. So multiple times throughout caring for the patients, we're washing our hands or wearing gloves or using the hand sanitizer. It's so important to keep washing those hands to just make sure everything's staying clean and not contaminating anything, especially if they have like a fresh surgical incision too, to not get any of that contamination on that surgical incision. Make sure you have some fresh, clean running water, and then make sure, obviously, use soap, scrub for at least 20 seconds, and then make sure you're especially getting like backs of the hands, in between the fingers, underneath the fingernails, the places that people usually don't think about. Just make sure you're getting all the areas, and then obviously rinse dry, and then use a clean towel or air dry to make sure that it's clean.